大家好，欢迎到7季妈妈俱乐部，我叫 Ivy。今天我们继续聊这个自然分娩的话题。那么今天我有很荣幸的请到2位美国专家。这一位是 Robin Wexler， 他是很优秀的分娩导乐师。然后这一位是 Barbara Harper， 她是很著名的美国的一位助产师。今天呢，我们来继续聊一聊剖腹产这个问题。因为呢，在中国呢，有很多的明星现在就是选择剖腹产，因为他们要保持他们的体型、他们的身材，他们就认为其实剖腹产，可以这样子生孩子，然后也可以保持体型。所以我们来聊一聊这个误区。不知道你对这个有什么看法 ，Robin？
我自己感觉，其实就剖宫产，我认识的就是很多朋友，就是生过孩子，包括我自己也是两个孩子的妈妈。我2个孩子也都是自己生的，就是阴道分娩呢。生完了以后，其实我觉得就是如果是顺产的话，这个产后恢复会方便很多。但是我觉得就是产后，我自己的概念在产后这一块，减肥不是我第一个目标。第一个目标是健康，就身体的健康、心理的健康。但是如果是顺产的话，其实包括母乳喂养，我觉得其实妈妈们的身体和身材就是很快就会恢复起来。所以我自己的感觉就还是母乳喂养对产后恢复，包括去保持就是一个比较好的身材，我觉得是最好的方法。
我记得我读过，就是一个母乳妈妈躺在那儿整天喂奶，一天可以用掉500个卡路里。
是，
对啊，所以很管用。那么 Barbara， 我们也想听听你的观点。
My experience, as well as my personal opinion, is that those women have been given misinformation, that there's no reason that they can't give birth vaginally and recover a whole lot faster and easier just through simple diet and exercise, including the breastfeeding. Breastfeeding burns a lot of calories, and let's put it this way: when you keep things in balance and harmonious in your endocrine system and your mental thoughts and in your body, your recovery time from a vaginal birth to feel yourself again is a matter of days, as opposed to a cesarean when it's going to take a matter of months before you can even stand upright without pain. And so those women who go in thinking that they're going to preserve their bodies, whether it be their shapes or maybe they don't even breastfeed because they think their boobs are going to hang down to their knees, you know. It's all old wives' tales. In Yiddish, it's called Bubba Meinsa. It's a grandmother's story that, and they didn't even come from the grandmothers. It came from the girlfriends, and you know who it came from? The men. The men, the misogynist types of men who said, you know, well, you're going to get a big butt, or you're going to, you know, your boobs are going to sag. And our hormones won't prevent us from changing our body shapes when we're pregnant. Everything about us changes. We have twice as many water cells when we're pregnant as we do when we're not pregnant. The minute conception happens, our bodies start changing. And the interesting part is that the majority of my clients that I've worked with come back into a body that's sexier, shapelier, more toned, and Yeah, honestly, the yoga really, really helps prenatally and postnatally. But the key here also is their vaginas go back and are tighter than before the birth because they've stretched out, yes, but the body comes back and gets all that tone in there. It's like stretching a muscle and then bringing it back and stretching a muscle and bringing it back. By doing that, you build up that muscle. And I've had husbands tell me, after I've worked with women, prenatally and postnatally, they come and they go, "Thank you so much. Oh my God, she's so good." So I think it's a secret in this society that if you're having a cesarean section because you think you won't be sexually attractive to your husband, it is utter lie, absolute lie. We are so capable of changing our bodies and then changing them again. The men should be jealous of us, absolutely, and I think they are in some ways, don't you?
其实挺有意思，因为我们经常就是我很多的中国朋友就会说他们一个担心就是如果自己生孩子的时候就是顺产的话，是担心就是未来夫妻俩的这个性生活是不是会受影响。所以听到 Barbara 老师还有确实就如果跟就是自己的朋友来聊聊，我有好几位朋友就是剖宫产完了以后，因为一般我们只会想着这个疤痕可能伤口就是在外面，但是这疤痕其实它也会往里长，所以我认识的好多朋友就是因为我们就聊的都就比较好呢，就其实会跟我讲就是剖宫产完了以后他发现是影响到就是夫妻俩的就是生活对，所以我觉得就是我非常的赞同就是听 Barbara 老师这样讲。包括母乳喂养，我们也知道，就是当就妈妈们在喂奶的时候，也肯定是比就是原来更丰满一些，所以这个就是对我们也是多好的一个产后的礼物，也挺好的，又可以吃得多。完了就是通过母乳喂养又就是会减肥，再一个就是身材也是比较性感比较丰满一些，也不是挺好的吗？
所以女人的身体就是那么奇妙，上帝造的就是那么奇妙。那么还有呢，有的人他们呢就是选择剖腹产是考虑孩子，因为呢在中国呢很多人喜欢很胖的宝宝，就是越胖生出来越胖越好，所以呢就是那有的妈妈就觉得那太胖了她生不出来，所以只能选择剖。那又有的妈妈觉得孩子可能剖腹产的孩子其实孩子会更聪明，因为呢这个头不会经过阴道的挤压然后变形，所以他们觉得这样子是一个更好的选择，就是剖腹产。那不知道 Barbara 怎么认为这一点？
I just happened to bring a baby with me. This is my little Lucy, who travels everywhere with me because she's my teaching doll. And one of the things that I teach is how babies get through the pelvis. And I do have a film clip that I'd really like to show, so maybe we can do that. I've learned from osteopathic doctors and chiropractors and craniosacral therapists the importance of understanding the fact that the baby's head, to get through the pelvis, has to kind of collapse its 22 cranial bones. They have to move slightly over each other. And depending on how the baby sits in the pelvis, that whether, what position the baby's in, you might have a head that's slightly flat on the back or slightly flat on one side or even cone-shaped. And guess what changes it back to normal faster than anything? It's one thing that any mother can do, and it doesn't take any money. You don't have to see doctors. But guess what that one thing is? Breastfeeding. You got it. When the baby comes through the pelvis, there's a pelvic inlet. The baby comes through here first and then has to come out through the outlet. And the size of these, the distance between these two bones is big enough to accommodate any baby's head. Even fat babies have a head that's pretty much the same size as a baby that weighs 2 kilos less. The head is what matters. And the juicier and fattier the baby doesn't matter. You know, doctors ask me all the time, well, shouldn't we do a cesarean if the baby is more than 3 kilos? And 3 kilos, you can go 5 kilos and that baby's still going to get through. And it's not a matter of pushing that baby out. That baby has a relationship with this mother's pelvis, and this bone in particular right here, it's called the sacrum. The sacrum moves, it slides forwards and backwards, side to side, and it moves up and down. It's like this little drawbridge that gets out of the way as the baby, comes further down. And do you see how this little coccyx moves a little bit? And so when a mother is getting close to birthing the baby, I don't have to stick my fingers in and find out that the baby's, right here. I can look at her back and feel this hump on her back that lifts up, and that tells me that the baby's come down. And as soon as the baby maneuvers its way, and she doesn't have to control this, the doctor doesn't have to control this. Every single baby is programmed in their brain to move through the pelvis and to do certain reflexes that will propel it all the way out. We don't have to pull the baby and yank the baby. The baby's just going to come out. And when the baby does that, then it comes up to the chest, and right here, even in the first few minutes, one of the first things that changes when we're welcomed into gravity is the cerebral spinal fluid starts pumping in a different way. And all 22 cranial bones have, over the next 24 to 72 hours, will go back into this beautiful, round, kissable shape. And the more the baby stays right here and has access to the breast, the quicker that baby's head is going to go back to normal. And when that happens, it kind of like turns on the baby's brain and sets up connections in its brain that, and breastfeeding does that as well, that is going to increase the baby's intelligence, the ability to read, the ability to have eye-hand coordination. All that starts through vaginal birth and breastfeeding. Cesarean, there's a doctor in Germany that shows a film to practitioners, midwives. We go to these conferences, and he shows a film, and he says, look at these children in the film playing in a playground. And they're all like 4 and 5 years old. And he said, see that one over in the corner? That one that's kind of walking kind of strangely. He said, do you see that? That baby was born by cesarean. And do you see that child over there skipping rope? that baby was born vaginally. And do you see that baby walking on that balance beam? That child was born in the water. And we're all saying, well, how do you know that? And he said, I can predict how the child was born by how it moves its body when they're 3, 4, 5, 6, 7 years old. There's so many things that are given to the baby who is born vaginally that are taken away from the baby when they're born by cesarean. Physically, we've already talked about the emotional side, but the actual physical connections in the brain, it's called the primitive reflexes. And there are therapists today that will help children who have reading problems and behavior problems in school kind of pretend to go back into the womb and crawl out again, and it's called regression therapy, physically, so that they can build new connections in their brain. So you want to talk to me about vaginal birth versus cesarean? I will show you children who have reading problems, behavior problems, and don't eat their vegetables. No, honestly, it's a serious difficulty with so many more children having these difficulties from not being born vaginally.
Wow， 谢谢 Barbara， 真是非常的重要。就是 Barbara 分享的，也就是其实呢，如果想给宝宝最好的起点，那就是自然分娩。这个和接下来就是母乳喂养，这样子是给宝宝一生建立了最好的一个基础。那么刚才 Barbara 也说到有一个短视频，我们可以一起看，所以我们现在就放一下视频。
Hey Dad, will you read me another story? Mom keeps falling asleep.
A baby will prepare for birth long before active labor contractions begin. During the last 4 weeks of gestation, provided her life is not consumed with other activities, a mother will spend many quiet hours connecting with her baby. Silently, they will get to know each other as they physically prepare for the journey of birth. During the final stages of pregnancy, a mother will help her baby line up his body so that her muscles can slowly twist and turn to maneuver him through her pelvis in a safe and natural manner.
When preparing for a birth, a mother must remember that the miraculous design of her body will help her baby slowly, gently, and with great precision mold his head to accommodate her unique shape. She must also realize that she will feel a need to move her body in subtle ways to accommodate her baby's position within the birth canal, and that she must tune into those needs.
This constant give and take, with each responding to the other's movement, is the dance of life, the miraculous journey of birth, and a true marvel of nature.
Mom, I'm getting tired of being squished in here. I'm hugging myself as tight as I can, but it's getting harder and harder to move my hands and feet.
Around the 7th month of pregnancy, the volume of amniotic fluid in the womb starts to drop. This change in fluid dynamics gives the baby more room to grow while decreasing his buoyancy. Gravity can now take over and pull the heaviest part of his body, his head, down against the lower cervical portion of the uterus. The uterus, the baby's spine, and the mother's spine will now all become parallel with each other. This is essential for an uncomplicated birth to occur. Ideally, after much tossing, turning, rolling, and playing, the baby will position himself with his back on the mother's left side. Most babies will assume this position because the mother's softer organs, the stomach, spleen, and pancreas, will move up against the respiratory diaphragm and make room for him to stretch out. There isn't as much room for a growing baby's spine to reside on the right side of the mother's abdomen because of the harder, less flexible liver that rests on that side. If the mother's sacrum is rotated, causing a subluxation at the site of the sacral iliac joint and a torsion of the pelvic bowl, An imbalance in the uterine ligaments will constrict the lower portion of the uterus, forcing the baby out of this optimum position. Gravity can no longer influence the baby as the tight, constricted fibers of the uterus force him to turn into an oblique, transverse, or complete breech position. Correcting the subluxation and restoring balance to the muscles and ligaments within the mother's pelvis, often called the Webster technique, will quickly and effectively restore the pelvis to normal, and the baby will drop back down into the optimum position within the uterus. During the third trimester, very gentle contractions that hug the baby also begin to push him downward against the cervix. These Braxton Hicks contractions should be mild and barely perceived by the mother. Ideally, the baby's arms and legs are now flexed against his chest. At this point, with the long axis of the baby's spine perfectly perpendicular to the long axis of his head, Braxton Hicks contractions will force the baby's spine downward, forcing it to apply symmetrical pressure to the condyles of the occiput. If the baby is positioned correctly, the contractions will slowly and gently force his sphenobasilar joint and head into a flexed position. As the baby's chin is forced against his chest, the vertebra will stack up and protect his spinal cord and nerve roots from the forces of labor. With his head tucked tightly against his chest, the baby will now have the crown of his head resting against the top of the mother's cervix, with the widest diameter of his head parallel with the widest diameter of the mother's pelvic inlet. In order for an unborn baby to effectively fit through the mother's cervix and pelvis, his cranial plates must slowly overlap each other, and the volume of cranial fluid must be reduced. This will be achieved through a unique process called cranial molding. As the exposed unossified dura mater folds inward, allowing the plates to overlap and reduce the circumference of the cranium, a protective encasement is formed for the many blood vessels that supply blood to the brain. The molding process begins when one parietal bone at the top of the baby's head comes to rest against a lip of a bone in the top of the mother's sacrum, called the sacral promontory. Ideally, this will be the baby's left parietal bone. The first layer of muscles, which are directed from the front of the mother's pelvis to the back, will apply pressure to the right side of the baby's head. This forces the right parietal bone to slide slightly under or over the left parietal bone. The reduced cranial circumference now allows the baby to slide further down, which forces his head to apply pressure against another layer of muscles that stretch from side to side within the mother's pelvis. These hammock-like muscles of the urogenital diaphragm will assist the baby in telescoping the cranial plates at the front and back of his head, under or over the parietal bones. Prolonged contact of the baby's head against the cervix will stimulate a cascade of hormonal responses in both the mother and the baby. The release of one hormone, oxytocin, results in stronger and more rhythmical contractions. When delivery is imminent, the mother's cervix softens and thins out in order to blend in with the wider part of the uterus. The shortening and thinning of the cervix allows the baby's head to rest directly against the os, the opening into the birth canal. Continued pressure against the os initiates the active stage of labor.
Whoa, Mom, do you feel that? We can do this, Mom. We can do it.
Birth is a dance of power, strength, and agility, provided both are in proper alignment and not forced to perform the dance of birth prematurely.
To help a mother deal with the intensity of labor and delivery, we often recommend the use of visualization and vocalization.
With intense contractions, we encourage a mother to use a vocal sound that will vibrate the lower portion of her abdomen and relax the pelvic floor muscles. We also ask the mother to visualize her cervix as a rosebud that is opening petal by petal with each contraction. At the same time, we ask her to visualize the baby's head getting smaller and smaller, like a rose whose petals are folding inward. Eventually, the baby's head looks like a rosebud that is sliding through the mother's open cervix, which now now resembles a rose in full bloom.
What the mind sees, the body feels.
If the mother's body is in a state of balance and the baby is in the optimal position, effacement, thinning of the cervix, and dilation, opening of the cervix, will be symmetrical, and the baby's head will now pass through the pelvic inlet. Now that active labor has begun, the baby's head will rest upon the mother's oblique pelvic floor muscles, which apply pressure to the side of the baby's head, specifically the temporal plates. As the oblique muscles force the temporal plates to fold together, the baby's neck muscles rotate his head toward his left shoulder and activate the primitive asymmetric tonic neck reflex. This will result in an elevation of the left shoulder, which then reduces the diameter of the upper torso. Ideally, the baby will turn his face toward the curved portion of the mother's sacrum, and the back of his head will line up under her pubic bone. The baby can now slide even further into the birth canal. Once he moves past two bony points inside the mother's pelvis, called the ischial spines, he will continue to turn another 45 degrees until the widest diameter of his head lines up with the widest part of the pelvic outlet, the vaginal opening. As the baby rotates through the birth canal, the contractile forces of the vaginal wall stimulate one side of his spine, which activates the primitive gallant reflex. This results in hip flexion and a decrease in the diameter of the lower portion of the baby's torso, allowing the baby's pelvis to slip through the fully dilated cervix. Crowning occurs when the top of the baby's head can be seen at the vaginal opening. As he slides through the opening, pressure from the anal gutter will force his head backward into extension. This will accomplish two things. 1. The back of his head can slip under the pubic bone, and 2. The primitive Perez reflex will be activated by strong contractile stimulations to the baby's entire spine. Extension of the baby's head will result in extension of the baby's pelvis and legs. That, along with the influence of the Perez reflex, will cause the baby to eliminate any remaining amniotic fluid from the lower urogenital tract. The result is a tight, compact pelvis passing through the birth canal. Extension of the legs and pressure of the uterine wall against the top of the feet will fire another primitive reflex that forces the baby to simulate walking, thus pushing against the top of the uterus. Once his head is out of the canal, the baby must roll his shoulders around so they too can line up with the widest diameter of the vaginal opening. To accomplish this, the mother's oblique pelvic floor muscles apply pressure to the shoulders, turning them until they can slip past the ischial spines. This results in the desired head rotation. As the baby's shoulders roll to line up with the vaginal opening, his neck muscles will slowly turn his head back toward his chest. Once the baby's shoulders are lined up properly, he will proceed to roll his body out of the birth canal. After delivery, the baby will intuitively cry out in vibrant bursts of sound to 1. Restore normal fluid dynamics by forcing cerebral spinal fluid and blood back into the cranium, 2. Force air into the lungs to initiate breathing, and 3. To initiate a proper rhythm within the craniosacral system.
The description of labor and delivery you have just watched describes an ideal birth. Without proper balance and alignment between mother and baby, a whole variety of potential problems may occur. If the labor is induced prior to the baby getting into position for birth, the labor may become stalled or arrested entirely. If the mother receives an epidural, she may not be able to tune into her baby's needs, and the level of endorphins normally provided to the baby may be reduced, resulting in an increase in pain for the baby. And unnecessary intervention and disruptions may reduce the mother's ability to work closely with her baby and her own body.
A mother and her baby are a team, and if the mother is free from muscular imbalance and unnecessary obstetrical intervention,
They're both capable of doing whatever it takes to finish the dance they so lovingly choreographed together.
Hi, you guys. I love you too.
刚才看到的视频的确是能帮助很多的妈妈了解，就是以前可能不了解的一些事情，让我们对我们的身体，以及神造的我们的身体更有自信心。